feel the pain here.
You feel in the hips now?
Yeah.
Okay. So the hip flexors, probably because I had you doing a lot of this.
Yeah.
So we're gonna have to release those. I won't be doing that with the cup, don't worry. Alright, and this should just kind of unload that whole left side joint, all those ligaments. We're just trying to suck everything in there at that attachment point and release that fascia that's binding it all together. Alright, so next what I'm going to have you do is lean all the way back into extension. Good. Forward. That's good. You don't have to go all the way down for this one. And lean back. Good. Perfect. All right, good. So now what we're going to do is head down to your glutes.
Okay.
And since the right side is really limited, we're going to get right in here on glute medius. All right, so what I want you to do is that same kind of movement, bringing that hip up and then rotating back and forth between internal and external rotation, just like you did before, but on the right side. Yeah. It does not want to go out, does it?
No.
See if you can keep it to 90 degrees.
Oh, okay.
Yeah, just like that. This time, let's just try to go out, right? See if we can just kind of do like little reps. Just slowly pushing a little bit. It's getting better. Excellent. Perfect. That's good. You can go ahead and bring it down. These muscles are going to help you extend back and also move your hip outward. Sorry. All right, let's do the same on the left side.
Just like.
Yep, internal, external rotation of that hip. Yeah, you really struggle going outward, don't you?
Mm-hmm.
And that's pretty common though, like most men.
Like with my right leg was easier than with this one.
Really?
Yep.
So our next area we'll be hitting is that IT band. How's that going on the foam rolling, by the way? Is it feeling like it's improving?
Yeah, it actually like hurts like less than than when we first started.
Excellent.
Yep.
All right, and just focus on going outward now. See if we can get that little extra movement in there.
That's it. It's like I can't.
I know, it's okay though. It's improving though. Each time you do it, it does improve. So, all right, that's good. You can take a break. So I'm trying to alternate back and forth, just so I don't overwhelm you too much. All right, let's see here. Alright. So this time what I want you to do is just bring your hip out. Okay, and then we're going to bring it forward and in. Forward and in. Good. Keep doing that. Does it feel restricted at all in either of those ranges?
On this one?
Not too bad, right?
No.
It looks pretty good. Perfect. All right, let's check. Yeah, right here. It's a lot more fibrous in here. There's not a lot of muscle. It's just adhesions, unfortunately. So you probably feel this a little more. Okay. So go ahead and repeat that same movement. Bring your right leg forward. And, yeah. Feel a little more this time?
No. Well, a little bit, yeah. It's a little like more restricted.
Yeah. Let's just keep it forward and then bring it out this time. Yep. Good. And then we're going to bring the knee back up, the right knee up, and do that internal external rotation again. Feel this one, right?
I don't know.
No?
Oh.
When you go out, right? You feel a little
Yeah,
bit?
yeah, yeah,
Okay.
yeah.
You can just go out. Perfect. All right. So, do me a favor.
Yeah.
Go ahead and move around. Let me know how that feels right now. You feel that pain?
I feel the pain here.
You feel in the hips now.
Yeah.
Okay. So the hip flexors. Probably because I had you doing a lot of this.
Yeah.
So we're gonna have to release those. I won't be doing that with the cup. Don't worry. So what we're gonna do is actually we're gonna have you go ahead and lay on your back face up. You okay?
Yep. I mean,
It's tight.
first, yeah.
Yeah, sorry. You probably never bring your hips up that much, right?
Never.
All right, so we're just gonna release that psoas like we did on that first visit.
Mm-hmm.
And I'm gonna go all the way through those hip flexors. So take a deep breath in, all the way out, let it go. Just breathe through it, it's really tight.
Feel right?
Yeah. Yeah, that's why I didn't want to do those exercises today because they're so stiff. It's like almost anything's gonna flare you up.
It was probably gonna be too painful to like resist it.
Yeah. I know, this really hurts. Do me a favor, can you bring Can you do this for me? Bring your knee up and then straighten your leg.
Left one, right one.
Right one. And down. Up and down.
It is. You can feel it.
So, I mean, these can definitely get tight just with sitting. And anybody who does a lot of cardio, running, cycling, really, as soon as you get that knee up off the ground, you lift the foot off the ground, you're engaging your hip flexors.
Okay.
So that would be the psoas muscle, your iliacus, and all the way down into your quads.
Okay.
That's all involved here.
Should I try that?
Go for it.
It hurts, but it feels good.
Yeah, it's releasing. But literally just a tiny section under my finger, and then I have to keep moving to the next spot. So, teamwork. So this part's good, though. Go ahead and drop that leg down. Just relax. Good. Sadly, you have two of them. Good. Take a deep breath in and out. This side's much better.
This one, right? Yeah.
Yeah, it's really not bad at all.
Yeah.
I think it's going to get worse down here, though. Breathe in and out. Go ahead and bring that knee up for me. Good. And down.
Yeah, it doesn't feel as bad as right there.
Yeah. That's good. You can just relax now. Perfect. Yeah, and if these psoas muscles are really tight, they're just going to kind of constantly keep you in this hip flexion position. So even if you're standing up, it's like you're kind of always flexed.
Yep.
And it's just way too easy to get injured. It's always going to be overloading your hip, your back, and it will keep perpetuating your back problem until you start releasing them.
And why does that happen?
It just, you're doing a lot of this.
Okay.
So like I said, it could be anything. It could be too much sitting, it could be running, it could be cycling.
It's probably a combination of everything. I'm sitting like all day long working,
Okay.
and then when I'm working out, I involve a lot of movements like that.
Yeah.
So
I know it stinks because it's one muscle that just like, it's like damned if you do, damned if you don't. So if you're sedentary and not doing anything, you're going to get tight.
Okay.
And then if you do both, you're really in trouble. So let's see if that made a change. So I'm going to have you stand up and see if you feel less of that tension up in the hips.
Yeah.
Feels better?
Yeah.
Okay, good. So I want to make sure, I'm going to show you how to stretch this, but if it hurts, I don't want you to do it.
Okay.
So, but at least you're going to know how to do it. And this might be a good idea before you exercise next time, just to loosen this up. So all you're going to do is basically take a big lunge forward. Yep.
But like actual lunge.
Like this is great. You don't actually have to drop down yet. So once you do that, then you're just going to drop that. We're really stretching this back thigh, and you just drop down. While keeping your torso up. Don't let yourself flex forward. You should feel this nice stretch in that back thigh.
Yeah.
So, and don't bend down. You don't want to like bounce. So
I mean, there I feel like I'm stretching it. When I do this,
not so much.
not so much.
So come back up a little bit,
Yeah.
and it could be because you're stuck in that flex position. I need you upright.
Okay.
Good. And then what you're gonna do, since the left leg's back, you're gonna reach your left arm up in the air. Reach up, really reach, and then bend. And you should feel like a more concentrated stretch.
Yeah.
And you just want to hold this for 1 minute. So I know we're challenging your balance on this one. And yeah, you'll feel it all the way up. Wherever you're tight, this is such a good stretch. There's an alternative way where you're down on the knee as well. It's really good. Maybe we don't want you on the floor just yet, though.
Okay. I can feel that.
So if you're doing any kind of stretching, you always want to hold it at least 1 minute, or it's not really helping you too much. I'm not a big fan of stretching before exercising, but I don't think it's a problem here because this is so fibrous.
Okay.
I just really try to keep that lengthening going the whole time. Like you'll see if you start to sag, you just don't feel much. All right, good. And then you just kind of come out the same way you went in. All right.
Yeah, it feels.
Let's do the other one. And the bigger the lunge, the better it's going to work. So try to do a larger lunge if you don't mind.
What is it?
So a bigger lunge forward works the best. Cool. Excellent. All right, good. Whenever you're ready, you can slowly come out of that. Does it feel a lot better?
Like way better.
Good.
Yeah.
Awesome. So, unfortunately, we're pretty limited till you can get back to the gym. So I think we do one more session of this. You're gonna be fine Thursday. We just have to make sure you're ready for it. So in the meantime, I just want you icing to get the inflammation down. 20 minutes on, 90 minutes off. Repeat. If you have biofreeze is really great to get that inflammation down. We just want to make sure we have no reason that you can't get back to the gym.
Okay.
So, yeah, as long as you feel good, I'm going to leave you alone for today.